Thanks so much. And I really appreciate the opportunity to talk to you all today. And I really enjoy working with Kathy Wilson Gold. It's so nice to have someone representing the older adults group. And I've shared with Ms. Wilson Gold that I have a really strong passion, especially for older adults, but working age adults. So when she invited me and said, hey, could you give a brief overview of some oral health objectives, to adults or older adults, I was really very happy to do that. And what I'm going to attempt to do is I do have some slides, but I also want to show you all the actual website so that at your leisure, you can actually go back and take a closer look at both Healthy People 2020 and Healthy People 2030. And just to give you a little bit more background, you may all be wondering, well, why is oral health important when you think about in the context of nutrition? And so I'm going to highlight today, this is a study that was from 2016, Global Burden of Disease. And it focuses on actually three main conditions, oral health conditions, and then one of which actually impacts not only adults, but children as well. And they include untreated dental caries or tooth decay and permanent teeth. That's actually number one from a global standpoint in terms of prevalence or how high the actual burden of disease. And then you have severe periodontitis, which is ranked number 11. And then untreated dental caries or tooth decay in primary teeth. So this would be for children and some adolescents. And then finally, severe or complete tooth loss, which ranks number 29. So I'm going to talk a little bit about the objectives first from the Healthy People 2020 perspective. And so I'll go through those a little rather quickly. It'll be three conditions that I mentioned have the highest burden on a global and one additional condition. And I may skip over a few slides just to allow myself enough time to go on to the actual website. So this first slide actually shows untreated dental decay for adults 35 to 74. And this is a Healthy People 2020 objective. And we have it broken out by ages 35 to 44 and then 65 to 74. And I did it that way just to kind of show you the contrast in terms of the disease level. So in the baseline for 35 to 44, it was 27.8. And then it actually increased. So it actually moved away from the Healthy People 2020 target. And the current estimate is 28.2%. And then when you look at for 65 to 74 years of age, the baseline was 17.1%. And then it actually decreased or went in the right direction because we definitely want to see a reduction in the amount of tooth decay to 15.8%. Now, this next slide shows the same objective of untreated dental decay, but it looks at it from the perspective of race ethnicity. And this is a big part of Healthy People. Dr. Cantor highlighted the actual goals from the start of the initiative to present day, and all of them really tie in the reduction of disparities and achieving health equity. So you see here, the blue indicates 35 to 44, and then the gray is 65 to 74. And really the main takeaway that I want you to see here is that, even though those numbers from the previous slide, showed in one case there was an increase, but then in the in some of the groups there was actually a objective 65 to 74, there was some improvement. And like here, you can definitely see, regardless of the age groups, that for non-Hispanic, Black, and Mexican Americans, there's definitely a disparity when you compare them to non-Hispanic white. Actually, in this particular slide, the 65 to 74, it's actually, better in terms of, in comparison to the younger age groups with untreated dental decay. But we would really like to see, it definitely moving towards the target and, obviously the prevalence decreasing. Now, the next one is to reduce the proportion of adults who have lost all their natural teeth. So that would be edentulous, essentially, somebody that has, complete tooth loss. And the baseline here was 24%. And we definitely see a definite improvement, reducing down to 12.5%. So what that tells us from a standpoint of the trend is that there's definitely been a decline in the people that have lost all their teeth, which means that people are keeping their teeth longer. So that's something, even for us in the dental field, but also from a nutrition standpoint. When we look at this again, we can see the disparities, probably more obvious for the non-Hispanic Black group, but definitely all the same. The disparities is definitely there. And then when we look at moderate or severe periodontitis, this is another condition very common to working age adults and older adults, and this is 45 to 74. We definitely see an improvement here from the baseline of 47.5%, and then a reduction down to 37.4% with the 2013-2014 data. And then the last condition, I'm going to back up. For the race ethnicity piece, we see similar to what we've seen with the other conditions, the greater disparity in the non-Hispanic Black and Mexican American group. And then finally, the one condition that wasn't highlighted, so to speak, in that study in Lancet, but all the same very important because of the risk factors, was the oral cancer detection at the earliest stage. And here the baseline was 32.7%, and this is for Healthy People 2020. And then the current estimate is 29.5%. So definitely we're not going in the right direction with respect to that. And then when we look at by race ethnicity, here you can see the disparity, and different from the other conditions, the disparity was much more prominent in non-Hispanic Black, and then the for this data set is Hispanic Latino. But here you actually see the greatest percentage of those having with the non-Hispanic White in terms of early detection. And so we definitely want to see that, but we don't see the disparity in terms of the Hispanic Latino, but definitely with the non-Hispanic Black, and then also the American Indian, Alaska Native groups. And before we get into this leading health indicator, I know Dr. Cantor mentioned the ones that were specific for nutrition. We have one as well for Healthy People 2020 and also for Healthy People 2030, and they happen to be the same. And this is for the dental visit. I'm going to try to get out of this and see if I can actually go and share the website. And Ms. Wilson-Gold, if you could just let me know if I'm successfully sharing this, I would greatly appreciate it.
Okay, perfect.
Can you all see it?
No, we still see your presentation.
Okay, let me do a new share. All right, let's see. Okay. All right, I'm going to do a new share. Do you see it now, Ms. Wilson-Gold?
Yes.
Okay,
perfect.
Great. All right, just so everyone can know, this is the Healthy People, and it's labeled as Healthy People 2030. And you really can get to that by doing the healthypeople.gov and then /2020. But either way, the 2020 or just healthypeople.gov, this will be the landing page that you'll see. And this actually has the Healthy People 2030, and it introduces the Healthy People 2030 initiative. And if you scroll down a little bit more, you'll get a lot of other information as well. And at the bottom, they actually have an archive for Healthy People 2010 as well, if you're interested in previous data. Now I'm going to just go over here, and I'll go back to the 2030 in just a second. Can you now see the Healthy People 2020 topics and objectives? Is that pretty? All right. Yeah. And here is what Dr. Cantor had talked about in terms of those 42 topic areas. You see access to health services, arthritis, osteoporosis, chronic back conditions, cancer, chronic disease, diabetes, disability and health. I mean, a wide range of things. And then you also see the older adults, which was new to Healthy People 2020, and then oral health. So you can click on any of these links and they'll take you right to the landing page for that topic, oral health. And then when you click on objectives, you can see all the objectives for Healthy People 2020. And one of the things that Dr. Cantor mentioned is that there were quite a few objectives for Healthy People 2020. And so they did downsize considerably the number of objectives. But here you can see some of the objectives that I highlighted in the slide presentation. And we actually had 33 objectives in Healthy People 2020. We currently have 11 objectives, Healthy People 2030, and 1 developmental. So here you see the access to preventive services. The OH-7 is the one for the leading health indicator. And I'm just going to click on it just to see if I can bring up the data. If you click on Healthy People 2020 data for this objective, you can actually get to a page, and it's taking a little bit of time to do that. I think now you should be able to see the OH-7. And when you go to that page, you can get information by, you can view charts, you can view disparities, and you can get all the different information by race, ethnicity, age groups. So it teases out every age group, you know, at least for this particular objective. And then educational attainment, family income, disability, geographic location, health insurance, specific for 65 and older, marital status. With this particular objective, and it's the medical expenditure panel survey, you can get a lot of information with respect to the actual data. I'm going to just go back to the topics and objectives page. So I'm going to see if I can get back to the Healthy People 2030. Go back one more time. Okay. All right, it's not doing what I actually want to do. I think I'm going to have to go out of it and do a new share. So see, I'm going to go back to my presentation first, because for the essence of time, I want to just make sure that I get everything covered. And I think now you should be able to see my presentation again.
Correct.
Yes.
Okay, great. So I'm going to go quickly to another a few more slides just to be conscious of the time. I mentioned already the leading health indicator, and there are webinars that took place in Healthy People 2020 that actually showcase, you know, the progress that we were making with respect to this particular objective. And then we also sometimes were able to combine it with other objectives in the topic area. When you look at this by race, ethnicity, you see that there are disparities that persist across certain racial ethnic groups. And this is presented as 2 years and older. And so now this is the part of the presentation. And I just have one additional slide that talks about the Healthy People 2030 oral objectives. And pretty much what we did, and going to the next slide, is we kept pretty much all of our objectives that we had from Healthy People 2030, but what we ended up doing is we collapsed the age group. So we still have the untreated dental decay, we have root surface decay for 75 years and older, and then tooth loss, severe periodontitis, and oral cancer detection at the earliest stage. I think one of the things I would like to emphasize, you know, to this particular group is that when you think about oral health in the broader context, you may not be able to make the connection with nutrition, directly. But if you think about it, if a person doesn't have an adequate number of teeth, and we consider a functional dentition based on 20 teeth, if they have less than that, it's going to make it harder for them to actually choose healthy foods. So those foods, in terms of fruits and vegetables, if they don't have enough teeth, they're not going to be able to eat an apple, even if it's cut up. So, really for oral health is actually important throughout the lifespan, not just for children and adolescents, but across the whole lifespan. And then when you think about individuals that have a combination of, they have the older age, they may have some issues with their teeth in terms of a loss of teeth, then, and you compound that with chronic conditions, we do have studies that show that individuals with certain chronic conditions like diabetes, heart disease and such will end up having, a greater burden of those diseases that I pointed out, the untreated dental decay, the severe periodontitis, and then the tooth loss. So you just really want to definitely be conscious of that fact that, individuals that, can't really chew the food properly, they're going to have limitations on the foods that they can actually eat and to have a healthy lifestyle. And then also it becomes aspects can be impacted in terms of social determinants of health, or that social connectedness to, interacting with other individuals. If you feel very self-conscious about your smile, you're not going to smile, you're not going to talk to people, and, you may kind of to yourself. And for older adults, when you think about those individuals that may have certain conditions, definitely Alzheimer's and dementia is really critical for them to have that social connectedness. And we definitely wouldn't want the teeth to be a barrier. I know we only have about 5 minutes, and I'll take my guidance from Holly in terms of, if we want anyone to ask me any questions, or if they're not quite sure in terms of the full connection. But I mean, one of the main things that I wanted you all to know is that oral health is definitely important. And there are things that we can all do to really help that individual that maybe has rheumatoid arthritis, that can't brush their teeth adequately. How can we address, issues of that concern? Just feeling good, the self-esteem about having their teeth and such is really critical as well. And I think for this group in particular, you can't really have a healthy body, so to speak, if you don't have, a healthy mouth, especially when we think about those foods that are much more nutritional in value in terms of fruits and vegetables.